Welcome to the next episode of the Link Podcast. I'm Karen Creveling-Hughes, co-host of the podcast and CEO of Community Link Consulting. Joining me here is Joel Hughes.
And I'm Joel. I am also a co-host of this podcast. A little background, I started Community Link in 1999. So we are coming up on our 25-year anniversary, and I'm kind of phased out. I'm retired, but have the privilege of being here today to talk a little bit about some of the history of the agency.
Awesome. Well, I'm really excited too. 25 years is a huge milestone for us, and I'm really excited to record that founding story and get some interesting tales from you. So the first question that we have is, can you take us back to the very beginning? What inspired you to start a consulting firm specifically focused on serving FQHCs, and what were some of the initial challenges you faced?
Oh, that's a good question. I know when I was, I think I'll start back when I was about 5 years old.
Nice.
But I spent a lot of time with my grandma, and my grandma and my mother both were sensitive to the populations that were poor. And then I went through high school, landed in Seattle working in manual labor jobs, and spent some years being very poor myself, and had a sensitivity, I think, to that population. And then when I was in Yakima, and I met Karen in Yakima, Karen's mom had written the grant for a community health center, which is an agency that is partly federally funded and is mandated by the feds to see the uninsured population on a sliding fee scale basis based on their income. And I worked in that agency as a CFO. I was the first CFO for about 4 years, and really saw the perspective of low income, people who were in poverty, people who were working hard out in that area. It was a lot of them were out in the fields working in orchards. And I really enjoyed it, and it is probably one of the more complex businesses I've experienced. I worked in public accounting, in the audit field, and of all of those, this is much more complex. And I started learning the nuances and the details of that business environment. And then it's a small community. We moved to Spokane, and I was the first CFO of a community health center here in Spokane called Community Health Association of Spokane. And I continued on with my knowledge or growing my technical knowledge. And I felt like I've always wanted to have a business. And I just saw there was such a need in administration of these agencies, related to revenue reimbursement in the medical industry. Medical reimbursement is complicated, and there's a lot of potential money that can be left on the table if it's not managed effectively. These agencies have some additional reimbursements, cost-based reimbursement in Medicare and Medicaid. And so I felt like with all the needs, there's just really an opportunity that is not being filled. And so I quit and started Community Link Consulting in 1999. I was working by myself. I wanted to say I appreciate Karen, because the course of starting a business, there's just a lot of constant demand administratively, as well as the technical side of the work the client wanted done. And she was always very supportive, and we saved for that, and we're at a point where I could start a business, and if I wasn't busy, then I would be able to make it fine financially. And that's kind of was a beginning. Initial challenges, the second part of that question. What were some of the initial challenges that you faced? I think one of the initial challenges, not really fully understanding when I started, but after getting into it, the demand for support was tremendous, beyond what I expected. And so I almost immediately started into a process where I was working an awful lot just to try and meet the expectations and the needs of the clients that I had. And I think the other challenge was when you're doing this kind of work, one of the goals I had was to be more of a full service company. And so I was writing grants, I was helping with billing processes, I was helping with accounting processes, I was working on change in scopes for agencies that were adding new services, which is a federal compliance portion. I was helping with rate setting, which is a reimbursement section. When you do all of that, even though I'd been in the industry at that point for 8 years when I started it, there was still a lot that I hadn't done. So one of the things that I was always a person that would say yes. And I remember telling one of our staff members one time, if you know more than the next person, you're the expert. So I felt like if I know more than the clients, I'm the expert. And I put a lot of time into understanding. I'd say yes to something I didn't necessarily know, but I'd put a lot of time into trying to figure it out and get it right. And I think that was another challenge, is just learning the technical aspects. So I guess that's a brief history. You know, I remember sitting in the basement of our home, which was a rock foundation, and I had a calendar with bears on it.
That was your very first office.
That was the first office. And I had that calendar. I'd put frame around the calendar pages and had bears around it, and I'd painted the rocks like a sky. So I was down there in this really dark, cold basement working in my up-brightened office space. You know, you just do whatever you have to do. I had a goal when I was young, or when I got into about 25 to go back to college. It was like God put this need or this desire in me, because I really had never the confidence to go to college and feel like I was smart enough to be able to do it. And when I was about 25, it was just like, I just said, you know what? I can go to college. I can get a degree. I can be as effective at whatever I need or whatever I want if I apply myself. I think that's an encouragement for everybody, to not let fear hold you back. And I went to college, and then after going through a divorce, I was really poor, but working 2 jobs, and just kind of got to the point where, you know what? If you want to succeed, you just have to set your mind to it and go for it. And this business was like that. It just was something I really wanted to do. I wanted to give it a try. So that's kind of the infancy of Community Link Consulting.
Okay, great. So the next question is, over the past 25 years, how have the needs of FQHCs changed, and how has your firm adapted its services to meet these evolving needs?
Well, I would say I think there's need changes within FQHCs, and there's also a lot of change that's been needed within Community Link Consulting, internal versus external. And internally, as you start your own business, you're really a jack of all trades, because you don't have a lot of staff. You have to do everything yourself. So administratively, for me, I spent consistently over a number of years about 30% of my time on administration. And as we grew and changed and took on more and more staff who didn't necessarily know what was going on, we were always faced with trying to manage the quality of the service and the performance and meeting the deadlines and the projects that we were given. And I think one example of that is we started providing CFO services. And after doing this for a while, I asked one of our staff members who had been who was a CFO for a clinic if he had looked at the accounts receivable. And accounts receivable in this industry is huge. It's bigger than the accounting system, the practice management system is. And as he'd been there for about 8 months, I was expecting an answer that was quantifying the status of the accounts receivable. And he said, I've been so busy, I haven't really looked at it. And I was like, oh, okay. We better come up with a process for managing that. So we came up with a checklist. So we went from a CFO to a checklist that the CFO, if they were new to this industry, could look at and decide or determine what were the pieces of the big systems within the CFO's purview that should be looked at. And then after a period of time, I started looking at some data and realized, well, we have a checklist, but we're not really evaluating whether the quality that's coming from our services meet the requirements or the expectations. So then we started a quality assurance process where we were meeting with the CFOs. So we went from a CFO, evolved to a checklist with major systems, and then from there we went to a quality assurance process to verify that the services that were being performed were accurate and appropriate. And that's an example of, I think, some transition that happened over the course of time internally. Externally, the industry, as I mentioned, is primarily and has been for years been focused on serving the uninsured population. It's the only system nationally, healthcare system nationally, that provides care to uninsured people who otherwise would land in emergency rooms. Emergency rooms are very expensive compared to outpatient primary care services. And those, I was very fortunate in that I had a mentor, Beryl Cochran, and she sat at the table with the feds back in D.C. when they created the program. So she really had been around for years since, started in the 60s, and was sitting there at that table at that time. And so she was a really good mentor and kind of helped me grow in the industry. But the point I'm making is the framework of the system has been in place since the 60s, and it hasn't changed. There's always some ebb and flow within the federal government around expectations and performance, et cetera. And we've had to adjust accordingly. And I think probably more than the feds adjusting their systems, we've had to really just continue to grow in our knowledge of all the different pieces of the system.
Okay, great. Yeah, I also think as I think about that and how things have changed externally and internally at CLC is just the advent of the acceptance of remote work and how we don't have the challenge of having to travel all the time to clients, but that it's a lot easier and more accepted to work remotely and to support clients so we can really leverage our time a lot better for them.
Yeah, that's a good point. Yeah, I when I was working, and I'm retired, so COVID was a really big impetus for the changes towards remote work. When I was working mostly before COVID, and I was traveling everywhere. I've been to Florida a number of times, Boston, San Diego, Alaska, Hawaii, and almost everything in between. I think I've been to 48 states. I have 2 left to go to. And part of the reason I retired when I did was just because I'm tired of traveling all over all the time, being away from home.
Yeah, I remember you had a number of years where you were working 3,500 hours plus per year. And a lot of that was coming because of the travel. So in that way, it has changed a lot at Community Link.
Yeah, it has. And that's good. Because I think at the time, I remember talking internally long before video conferencing was prevalent, that we should set up a cube in our office where we can do remote work, because it just seemed like such a extravagant cost to pay by the client for us to go somewhere for services when it could all be done remotely. I remember one trip I went on, it was for an hour-and-a-half meeting, and it took me a day to get there and a day to get back. And the cost of getting there, and both for my time as well as the cost of the plane tickets, was phenomenal compared to the amount of time I actually spent at an hour-and-a-half meeting. So I remember calling Karen. Karen and I are married, by the way. Calling Karen after I went somewhere, and she says, "Now, where are you at?" She didn't have a clue where I was even at. I think I was traveling around too much.
I know. I remembered another call like that. I got a call from a client, and he wanted to talk to you. And I said, well, he's on his way down there to see you today. And then I realized after I got off the phone, you weren't anywhere near where he was. So looking back over the quarter century, can you share a couple of milestones or achievements that you're particularly proud of?
Yeah, one thing I'm proud of is the relationships. I think that's been a component or a piece of what we've tried to teach our staff is when you're working as a consultant, you're always having other people that are other consultants, other competition that does the same thing that you do. So what differentiates you? It's just the product you're producing. And when you get into a longer-term relationship, which is always part of what we wanted, one of the business goals was that we were an extension of staff, which means that we're going to help with whatever needs to be helped with. And the client is going to recognize us as the agency that they can go to get help. But again, if you're only doing a product and you don't develop a relationship, if you do something wrong on that product, then they can have somebody else that they can go find that can do the work. I think the thing that differentiates that is the relationships. If you have a relationship with somebody, just like a marriage, you're not going to go, well, you made a mistake, I'm going to go find another husband. It's like there's a grace that's extended at that point. And I've seen this over and over and over. We all make mistakes. I've made a lot of mistakes. But if you have that relationship and an open, honest conversation with people, there's always a willingness, almost always a willingness to forgive and move forward. And it goes both directions. And I think that's one thing I'm really proud of. I remember when I was young in high school thinking, boy, I don't know if I have really any skills to speak of. The only thing I know how to do is get along with people and work hard. And as I look at Community Link, it's about the two components that have made Community Link successful. It's, well, I can get along with people, I can develop relationships, and I can work hard and meet expectations by working hard and accomplishing, being reliable and showing up on time. So I think relationships have definitely been one of them. Another one is just having a good, broad technical knowledge. I had a client down in, they were residency, and I got this phone call, and he said, we've been working on becoming an FQHC for, 5 or 6 years. We hired somebody in New York, very expensive, and they haven't really gotten us to where we needed to go. And I got your name from another one of the clients that we work with, and we were wondering if you can help us with this. And it wasn't that complicated. And we got to where they needed to go probably within a year, which was from not being an FQHC to being an FQHC lookalike. And when we got through with that, he said, well, it's amazing that was so easy. And I think, I'm proud of the fact that I knew the systems, from billing to federal compliance to accounting and reporting, and was able to take them from basically starting point to accomplishing what they needed to or wanted to accomplish, changed their financial situation tremendously. And the cost at the time, our cost was minimal compared to what they'd been paying that client or that company in New York. And so I think that's another area that I'm proud of, that able to come to the table with a grasp on this industry, a broad grasp. Many times I've been asked over the years, man, where can I get this information? Is there a single place to get this information? And when you're dealing with Medicare, who has its own set of rules, Medicaid, which has its own set of rules following Medicare's loosely, and then 50 states all manage that themselves. Medicaid's a state-managed program, even though there's federal match in that. And all the federal compliance under the grant, because there's a grant as well, but that's another body of the federal government that manages that. So that's another component you have to have understanding of. And then the accounting structure and reporting structure. And then you get into all the other components dealing with the board of directors and managing staff. There's a lot to know. And, I'm proud of the fact that I know that stuff.
Well, not to mention all the acronyms. 340B, OSV. You can just go on and on with every acronym. There's a whole system behind each one of those.
Yeah, there is. I don't know if you remember that graph we put together a few years back, but it was all the components that support just a medical clinic that come from this industry. And there are probably, 10 or 15 circles, each with an acronym in it, and each one of those with a whole body of work behind it. So.
Okay, great. So can you share a particularly impactful story where you felt your firm truly made a difference for an FQHC or the community it serves?
Yes, I could give you a couple. Maybe I'll give you 7 or 8. I've got all kinds of time. When I started Community Link Consulting, the state of Washington was just going through a Medicaid audit of the cost report. And they had hired a guy who I knew, and he was the one that was working for the state that was going around to these different clinics. And his attitude was, I'm working for the state, and if these clinics don't know what they're doing, that's not my problem, that's not the state's problem. I'm going to find the areas that they've made that are in favor of the state, and I'm not pointing out anything that could benefit them. And so, and the timing was great. There's this podcast called How I Built This, and at the end he asks, was this a function of luck, or was it a function of, your hard work and skill? And so much of, I think, as I've thought about that question, is it's luck. And for me, or God's grace, God's timing. But for me, I started right when this audit was getting started. And the way that guy was going about the audits, all these clinics were coming up with, hundreds of thousands of dollars of liability. And there wasn't anybody else, as I'd mentioned earlier, there really wasn't anybody else out there that was helping. So by default, I was the one that was getting the phone calls for help because I was the only one in the state that was doing this kind of work. And I had one call from a client that called up and said, this guy is your best marketer, because everywhere he goes, it pisses off the client, and then there's nobody else to call but you. But in the course of I can think of 3 clinics that I came to after he had given his initial report. They panicked, they had big liabilities, they called for some help, I was able to come in. and save them, I'd say between those three clinics, between $400,000 to about $900,000. Most of those went from a liability to a receivable. And one of the clients was Steve Clark. And after this guy, we got through the processes, he started calling Steve my little friend. He would never call, he would never reference the clinic or talk about it. He called him my little friend, probably because he's the one that ended up, in my opinion, they ended up losing a lot of money. The state didn't lose it, but it kind of corrected, I think, a lot of not just technical improvements, but kind of almost a personal vendetta that felt like this guy was carrying out to all the different clinics. Another example is there's a legal firm in D.C. called Feldsman Tucker, and Feldsman has been the go-to legal firm for community health centers across the nation. There's about 1,300 to 1,400 community health centers in the country, all over the nation, and the managing partner, Ted Waters, called me one day. I was sitting in my office, and he calls me up, and he said, "Hey, are you able to go to Missouri to help this client?" And I'd known Ted. I talked to him a little bit, but I didn't know him very well. And I said, "Yeah, we could. What's the situation?" And he said, "Well, they had a CEO who's on administrative leave because of some potential theft, and they called us in to help because we're the legal firm that is known." And I started looking at their financials, and I think they have some much bigger problems than the CEO because their financials look really bad. And are you able to come back here and help them out? And being the person that always says yes, I said yes. "Why are you calling us?" And he said, "Because you're the only one I know in the country that's doing this kind of stuff." So we went back there, another guy and I went back there. And the first thing I did is the grant cycle in this industry is a 12-month cycle. It's called the budget cycle. And it may be, January 1 through December 31st. It might be April 1 through March 31st or whatever. It's a 12-month cycle, and you get an amount of money, whatever that is, for a 12-month period. And ideally, you'd take that money and divide it by 12, and on a 1/12 basis, you'd pull down however much that is. And you'd get through the end of the year, and you get another block, and the cycle just keeps going. So one indicator is if there's no money left, or if it's a disproportional amount that they've pulled down, it means they're using that federal funding to support operations because the other revenues that they're generating through medical billing, maybe from donations and other grants, is inadequate to support them on a proportionate basis. So they're using federal money. So we went back there about December. I think we landed about December 2nd or 3rd. And I pulled out the data. I looked at the detail. And they had run out of money in November. So their cycle was from April 1 through March 30th. They'd drawn down all their federal grant in November and didn't have any more federal funding to help support them for operations through till March 31st. And then additionally, their CFO had been the billing supervisor, and their revenue cycle was all messed up. And they had debt that was just unbelievable from accounts payable. Usually accounts payable you pay off every 30, maybe 60 days. Their accounts payable was out there about a year, and they had vendors calling all the time, wondering when they were going to make payments. And it was like, you guys are going to make some big changes. And if you're willing to make changes, I think we can save this. But you're going to have to commit to this. And the guy was, the guy that was a CEO at the time had been working started at the IT department. And he was a nice guy, and I think he showed up to work every day, and so they made him the CEO. And he was really a good guy. And he said, hey, I don't know anything about finances. You guys tell me what to do, and I'll do it. So that, like the next day, we got about 3 of their leadership in the room, and we projected up on the wall all their employees. And the question was, who can you cut out of your budget? And it's a sad situation because they had to cut people out of their budget, people that rely, small communities, probably 80, 90 miles to a major community. This was the only healthcare system. They had multiple sites, 5 or 6 sites in these little communities. And they were the only systems that was out there for these rural residents. And we were sitting in the conference room going through the list, cutting out sites and cutting out staff. So because of management, it's a sad situation. But the other option was they were going to go bankrupt, and they wouldn't have any sites anywhere if they didn't make these decisions. So we went through and cut about 30% of the staff, and within a week or two, they had terminated those staff. We called up all the vendors and said, you guys, we owe you money. We're basically going bankrupt if you don't work with us, but if you work with us, we'll make it go. And it's your call. And everybody said, we'll work with you. And anytime they had to spend money, they called us and said anything beyond just what we'd already given them approval for. And we stuck to that thing like a iron. It was like, this is the way we got to do it. And in the end, we got them till April 1, where they had federal funding. We got their accounts receivable worked out and cash coming in from that accounts receivable. They were looking good. And about probably 2 years later, the Missouri Primary Care Association asked us to come back and do a presentation on that. And we kind of walked through the whole process at this presentation, and one of the board members who was on their board came up afterwards and said, if it wasn't for you guys, we wouldn't be here. And she said that, I always say now, make sure you have cash in the bank. So if you're going to be hurting your cash, we're not doing it. She was fun. So those are a couple. I mean, there's a lot of, I think the one thing about Community Link is we are providing a basic need in an environment where, there's a real potential for cash shortages. And it's a fairly complicated industry, and we bring that technical knowledge, I think that flexibility and creativity to the table, which is hard to find, especially in rural areas. You can't find somebody in a rural area that has the background. It's hard to find them at a national level, let alone at a rural level. And so we're able to come in and support those agencies. So there's a couple of examples, but my point is, I think most of the clinics that we're working with are clinics that really, truly need the help. And this is a bit of an aside, but I think we as a society tend to, bucket ourselves in our own socioeconomic group. And people who are middle income, upper income, don't see what the struggles of the low income are and the challenges that they have to face on a daily basis. And part of our mission, part of our vision, our core values is that we come in and, we don't put up with disrespect, but as long as you're not disrespectful, we will go a long way to help you.
So what have been some of the biggest learning moments or surprises for you while running the firm, and how have they shaped your approach?
Well, I would say one area that has been this ongoing process for me personally, but certainly for Community Link, is delegation. When you start a business, as I said, you're a jack of all trades. And when you look at what we do, there is a lot that we do. And what really happens is if you get busy and you're doing all that work yourself, and you're not delegating effectively, there's 2 or 3 things that are really happening there. One is you're bringing on staff to help. If you don't delegate that work to them, it puts them in a place where they're not able to grow and build confidence and feel good about what they're knowing, what they know, and how they're supporting the clinic. So you're taking away an opportunity from your coworkers. Another thing you're doing is you're putting yourself in a place where everything depends on you. We had a clinic we were working with, Crystal, one of my coworkers early on, and I went to this clinic, and the CFO had quit. Well, the CFO was the one that closed the books every month, the one that closed the practice management system every month, the one that approved payroll every month, the one that did the grant drawdowns every month. And they basically were sitting, in a room with systems that were about 3/4 to 80% done, but they couldn't go any further because they didn't know how to go any further. They didn't know what the last piece of the puzzle was because the CFO wasn't delegating any of that. It was all wrapped in her own little world that she wanted control of. And it not only hurt the individuals by not giving them exposure, but it also hurt the agency because they couldn't keep things going. So I think delegation, and it's the same as we've grown, it's like you have people coming in who don't know all of the work that needs to get done, all the technical side of it. We have people who are, not maybe comfortable delegating. They want to do it themselves because they want to do it their way. And I think when you look at how the system is built, how it's meant to work in the end, how it's, it just is going to flow, is you have to delegate, you have to define what roles are out there and who's doing them, and let them succeed. Let them fail perhaps in the process, but failure teaches you. Failure is what makes you successful. And as you give them that grace and that extend that opportunity for them to learn, they will learn and make the system much, much stronger. I've said for years, I've said this to a number of board members, is that one of the things that makes you successful as a board, as an agency, is institutional knowledge. And institutional knowledge is that knowledge of how processes work. And one person in this industry especially cannot do all of that. They have to delegate. And that has been, like I said, it's been sometimes hard for me, and it's been hard for, I think, our staff. And it's also hard for people working in clinics. And I think that what I used to do is if I was feeling overwhelmed because of the workload, I would write down everything, take a half an hour, write down everything that I had to do. And I'd go through and write out, who can I delegate this to, or can I delegate it? And oftentimes those things I put on myself to do. After I went through that process, I was able to delegate out to others much of that work, relieving a lot of my stress and giving work to other people in the office. It's, I think, really been one of the critical processes of Community Link Consulting is understanding the need to delegate. Another, I guess, learning moment or process is we do a lot of different things, and you have to have systems in place in order to train, maintain quality, and that's been a constant process of, I think, redefining it. I retired more or less 5 years ago, And I think, Karen, you have taken on the process of defining and growing and building more of an infrastructure that is foundational, enabling growth more appropriately. And I think that's another phase of Community Link. I was working really hard for a really long time, and I did not have the time, and I probably didn't honestly have the knowledge to be able to kind of build that next level, enabling delegation. And I think that's where you've come in at a really good time, and you've picked that up, and we remember sitting up at the cabin with Peter, developing kind of the first step in that EOS process.
Mm-hmm. Yeah, that's been huge. It is a classic founder's dilemma where everything is reliant upon that charismatic, visionary individual who has started everything, who has the knowledge. And it's that great challenge to take it to that next level, to remove that pressure from the individual.
Mm-hmm.
But yeah, that was a lot of fun. I have great memories of sitting down and just really distilling what are those core values that we've been living by all this time.
Mm-hmm.
And that's a really memorable time for me.
Yeah. Yeah, I've said for a long time that every business has two businesses. One is the product that you're building. So you may make widgets, make brake shoes. It's like there's a brake shoe, but the other business is running the business, because running the business isn't building a brake shoe. Running the business is sales, marketing, finance, inventory management, if you have inventory, staff management, more so in our case because we're a service company as opposed to a products company. And you have to understand that those are two different processes, and you really need to look at them like that. I'm trying to remember the name of that book that I read, and it talks a lot about delegating, and talked a lot about how people get into business because they know how to make a brake shoe. And once they start into it, they get burnt out and they just quit. And it isn't necessarily because their cash isn't good or they're not making money, but it's because they just can't stand or can't handle the stress of managing the business. And that's, I think that was a really good takeaway, something that is kind of critical to our success.
Mm-hmm. So what have been some of the ways that you would describe the culture within your firm, and how has this culture contributed to your success and longevity in the industry?
Well, we have, I mentioned a minute ago that Peter is a guy I've known for 30 years, literally, it's almost 31 years to the date. Mm-hmm. The first job in the first community health center I worked at was in Okanagan, Washington, and Peter was on the team that interviewed me. And I think I started that job on February 2nd of 1993. And so Peter has been, a big part of my life for 30 years. And eventually he came in 2008, I think, and started working for Community Link Consulting, and was real critical part of our ability to grow. And I think the thing with Peter and I think me is we both kind of understood that, you got to manage the people and the relationships and obviously create a product for them. But I think as we've started and continued to grow, as I mentioned, that Karen and Peter and I sat down at a cabin about 2018, I believe, and came up with our core values. 7 core values?
7 core values.
And I don't know if I can remember them, but it was leadership, curiosity, flexibility, subject matter expert extraordinaire, SME, give more than you get. What are the last two?
Solution focused.
solution focused.
I should have been counting on my fingers. I always do it.
We're one short where I've got 6. But anyway, I think the core values that we came up with in 2018 were put on paper then, but those core values existed from the beginning. And I can go through each one of them and probably spend another 3 or 4 hours talking about all of those, because I think they're absolutely critical to who we are, what kind of an agency we are, our success. But I guess briefly, like one example is leadership. So many times you come into these agencies and you're working with people who don't have all of the technical knowledge necessary. They might have a real clinical expertise. They might come in with a real business background and know nothing about clinical. They may not be looking at systems, but rather looking at individual situations. So they're reactionary as opposed to planful. And I think the one sales component that has really helped make us successful is leadership. It's something I think we think about as being those people at the very top of an agency, but leadership is really something anybody can exemplify. And I think what that is recognizing the need, having the experience, and stepping up and filling it. This job has been more of a lifestyle than a job. And I think, not necessarily always right probably, but, I've had the ability, flexibility with care and support to work to help clinics achieve what they need to, and not just work 40 hours a week, but work more as necessary. And I think part of that is recognizing leadership's absolutely critical. People sit back and say, what am I supposed to do? And you have to step up and say, this is what I want you to do. This is how you need to do it. And I will support you through that process. I think that has been and will continue to be for anybody in business, is you fill the gaps that are necessary and you show up on time. People are going to want you around. And I think that's what leadership is. I think giving more than you get is another one of our core values that I would really emphasize. Rather than looking at it and saying, I'm putting in my time and you're going to pay me for my time. We have a project, we're going to get this project done. Very often it would be more work than I was expecting it to be when I was working. But I felt like, you know what? This is what I said I was going to do for these guys. I'm not doing this just for the pay. I'm doing this to make these guys successful. I want them to be successful. They need to be able to provide services to the uninsured people who otherwise don't have the care. And we're going to give more than we get if that's what it takes to get the job done. And like I said, I was very fortunate because I think care and supported that and allowed that. But it's also, I think, an attitude that I had, in that I wasn't looking at it just for what is in it for me, but it was more around how can I help you get to where you need to go. That's kind of one of my own personal philosophies and goals, is that we're only going to be around this world for a short time. And if I can help somebody achieve something that they need and helps other people, that's important to me. So as we look at the others, I think another one would be curiosity. There are some, I think, services that we provide that take some extra curiosity. You have to be curious and understand and work to understand what is it that is going to work and really complete the cycle or the system that you have to complete, like cost-based reimbursement, and not just kind of running through the detail and getting it done and moving on, but taking the time to understand it and make sure it's right and it's to the benefit. As an example, one example on that is when you're doing cost-based reimbursement, you take your total costs, that's your numerator, and you divide it by the denominator, which are your encounters. And you can change your costs, depending on the size of the agency, but you might change your cost by $500,000 or $1 million, which is a lot of money, but as a percentage, it's, if the budget's a $50 million budget, it's not huge. On the other hand, if you focus on the encounters and really only include, and that's a denominator, it's total cost divided by encounters, the number of visits, and you focus on that number, I was often finding that clinics were way overstating their encounters, and they were including visits or services that weren't face-to-face visits, what defines an FQHC encounter. So they were overstating that encounter number and thereby reducing their overall total cost per visit. So their reimbursements were reduced based on that overstatement of your encounters. So spending some time and really delving into that makes a huge difference. You can, if you can take, 100,000 encounters and change it by 10,000, that's has a much more impactful value on that rate than reducing your costs. But people tend to focus on the cost, and I think the reason is because encounters are a lot more complicated. I remember working with a state and asking them, what are you doing to validate encounters on this cost report? And they said, we don't look at encounters at all, because that's way beyond our ability to manage or to investigate that. We don't know how to do that, so we just rely on the client. Well, if the client doesn't get it, then they live with that reduced encounter in perpetuity. I had a client in a little community, and I looked at the productivity of a provider, and he was doing about 7,000 visits a year based on their cost report. Their cost report had been done by a public accounting firm. And I looked at that and said, yeah, I haven't been in this industry a while, and there's no provider I've ever come across that can do 7,000 encounters. And I started looking at the detail, and they'd overstated their encounters by about 40% because they were picking up all these codes that weren't face-to-face visits. So we went back to the state, redid their cost report, went back to the state, and their rate went from like $85 up to about $135. And I think that curiosity is an example then of something as well in our core values that I think has contributed to our success.
As a leader, what principles or philosophies have guided you through the ups and downs of the past 25 years?
Well, I think, again, it comes back to core values. Why are we doing what we're doing? Are we doing it just to make a living and charge out a rate, or are we doing this to help clinics succeed, services provided to patients that might not have services? And I think the core values then become key and have been key to really enable us to maintain consistency, treating people with respect, knowing that we're working hard and the money that they're spending for us is valuable because they're getting something that they otherwise wouldn't be able to get. I think having good relationships with staff is another area that's obviously made us successful because we're a service company. We rely on our coworkers. And I think back on, the years of Community Link, and we've had some, great coworkers. Peter, as I mentioned, who's absolutely critical. Vicky and Joanna back when we were small, but starting.
I think flexibility plays a big piece in that too.
Yeah,
as you're talking about
I think
that.
that's a really good point. Because we are a consulting company, a lot of the project work we get, it can be done at 8 at night or 4 in the morning or during the day, as long as we're delivering a product. And I think we recognize we don't need to maintain this rigid structure where everybody comes into the office at 8 and leaves at 5, but we're able to allow flexibility personally for those people that are working with us. I remember there was a point where we had a little office in our house as we were growing, and we moved into another office. And my goal is that I liked working on projects, and when I worked on them, I didn't like a lot of interruptions. And so every day at this new office, people were coming into work every day, and I was getting interruptions. So I made a rule that everybody needs to stay home, and they can come in and work 1 day a week, because I want to get stuff done, and I don't want any interruptions during the day. And I kind of kicked that off, and every day everybody was coming into the office. And I'm like, what's going on? I told you guys to stay home. We can stay at home and work. We don't have to come to the office. The vision is really of kind of this virtual office that we don't have to come to every day. And it was surprising. People basically said, we want to come to the office because we like coming and working together. So it's like, that trumps my need for, I guess, quiet time. But I think it gets to the point is that from way back when, we've kind of approached our work as flexible. As long as the quality is there, the product is getting delivered on time, et cetera.
Mm-hmm. Yeah, and that remote piece, because I think about that, the very first employee was remote. So we've always had that as part of the philosophy as well.
Yeah.
Even if they didn't accept it all the time. So as you look towards the future, what emerging trends in healthcare do you believe will most impact FQHCs? And how is CLC preparing to meet these challenges?
That's a good question. I think the future of healthcare is a really interesting question. As we move, primary care, which is what this community health center niche is really providing, for the most part, primary medical care, dental care, behavioral health care. Then you get variables within agencies. Maybe one agency does housing, healthcare for the homeless, or some other service. But primary care I've looked out over the past 25 years has become a lot more outcome-based, quality, performance-based. The feds have gone through their own iterations of measuring and managing quality and output, and they have a certain authority in dictating performance because they give these clinics a significant amount of money every year. So there's this improvement, constant improvement in quality process, like diabetes. How are we going to measure that? The feds say, well, let's get a baseline, let's set a goal, and let's measure performance against that goal, and let's have internal processes that clinics are following so those people are getting rechecked on a regular basis, and they know where they're at, and we're educating them on how to manage their diabetes. And those are kind of systems improvements. It's one of the things in Obamacare, that's a whole other conversation, but one of the unknowns or kind of unseen values of that is that there were some improvements around quality, continuity, that you don't necessarily know about, but I think they kind of started moving systems into a more outcome-based approach. And then I think also technology has implemented or it has been imparting improvements. Data management is much faster. Reporting on these quality measures I was mentioning. System continuity across the entire spectrum of care for somebody who needs health care, from primary care all the way to specialty care to ancillary to hospital care, in a single or accessible chart that can be coordinated across the board. So I think that process will continue, and I think for us as a consulting firm, understanding the impact of technology, AI right now is a big issue, and I think it will be affecting healthcare. And I think it's probably, my prediction is at some point we're probably going to be interfacing with a computer, and outside of a computer diagnosis, there may be some review. Or certain circumstances that would require interaction with people, with a person. Also, in our specific niche, because we do a lot of accounting work and routines that are consistent amongst clinics and month to month, year to year, there's going to be improvements in automation that happen around that, and we need to be aware of that, and working towards training our staff to fill the gaps or the niches that the computers can't do, but are still necessary and important, required. When I look at how we do our business, I was reading just the other day this book my son gave me about the guy that started Chevrolet. His name was William Durant, and this was back in the 20s, and this book was talking about how his comment is that the business opportunities today are far beyond any point ever in the past. And as I look at our business and I look at the opportunities, I would probably repeat his statement in that right now there are so many business opportunities for Community Link. It's not so much about taking advantage of them. It is about finding the staff and training the staff and making sure the quality of our service really is maintained while we grow. But we have all kinds of business opportunities. And if you need any ideas, let me know.
Awesome. Okay. What advice would you give to someone looking to start their own consulting firm in the healthcare sector today?
Oh, I was talking earlier about how I got out of high school, went to college a couple of years, then I went to Seattle and I worked manual labor. And when I was working manual labor, I was hauling sheetrock. And that was you'd think it's manual labor and it's easy, but it was a hard job, and it probably taught me more about responsibility and how to work than any job I've ever had. And I remember when I was working there, I thought to myself, anybody can go into business. You basically have to have a business that has some margin, because sheetrock didn't have much margin. Margin, by margin, I mean there has to be some net income. And then if that's there, and you're willing to work hard, and your quality is good, and you treat people with respect and communicate, because communication is critical, you're going to be successful. So I guess my suggestions to aspiring entrepreneurs is determine what you do and do it well. You have to know what you're doing, but otherwise, it's really taking a risk. It's saying I'm making a commitment to step outside of what's comfortable, and I'm doing something that I know, and I'm going to work hard at it, and I'm going to do a good job at it. And I think as I look at it, so you're reliable. You know, I was one of the things at Community Link when I told somebody I was going to be there at 8 in the morning, even if it was in Yakima, I'd make sure I was there at 8 in the morning. They always know. I also, when I got a phone call or an email that said we need some help, usually within about 2 hours, I'd respond to that with a note. It wasn't 2 or 3 or 4 days later, but they needed to know that I was there to help them, and when they needed it, I was going to be immediately responding, which I did. And I think that's another piece of that is follow through is imperative. It develops trust. It develops confidence in their reliance on you. I think you have to take risks. If you see a vision or opportunity, step out and take it. Make sure you maintain the quality, and you need to know the business.
Well, I think just to clarify, you said when you'd respond to clients so quickly, you wouldn't always have the answer right at the moment, but you're at least responding and saying, I got your note, I'm working on it.
Yeah.
This is when you can expect to hear back from me.
Yeah. I mean, oftentimes I wouldn't even know fully what the need was, but you know, the thing that it's kind of been mystifying to me over the years that somebody will call and you don't hear anything back. And all it takes is like 5 minutes and say, I got your message. These are emails. You know, I got your message. Let's set a time to talk. Do you have any time tomorrow or a week or whatever? And a lot of times, even when there was a call on a project that we were working on, I knew in some cases I may not have even started the project, and they were expecting it to get done. But I was able to recognize that this stuff can't happen overnight. So though I haven't started it, they don't know I haven't started it. And I can get it done within a deadline. And so responding and letting them know, you know, this is on my list, I'm working on it, you know, giving them confidence that, you know, they're important to you and that you're working on their needs. It's just so critical to, I think, success. I mean, when you get a phone call, if you leave a message for somebody and they never call you back, you start losing confidence in that individual and in their ability or willingness to help you out. What's a business for the most part? It's helping people out. So you respond quickly. You know you're polite. It's like half the battle's won at that point.
Mm-hmm. Okay. So on a more personal note, what has been the most rewarding aspect of leading this firm for 20 plus years, and what legacy do you hope to leave behind?
Well, on a personal note, one of the rewarding aspects is being able to work with you. We've had a lot of hours talking through processes and things at Community Link Consulting that probably most couples don't talk through, just because Karen and I have a similar background. You know, even though she wasn't doing the technical work, she's been a part of this thing from the beginning. And so we still continue to have those calls, and that's always been a very rewarding component of my life.
Yeah, it's a dynamic and interesting topic, the business is, isn't it?
It is, yeah. Yeah. I think the relationships, another very rewarding aspect. That's always kind of refreshing. There are always surprises in relationships. And there's also that, I guess, sense of being comfortable with people I was on the phone with a client that I'd worked with for years the other day, and it was just really nice to have that conversation. I felt very comfortable, kind of familiar. I miss those relationships. So that's another rewarding aspect of it. I think the success of Community Link Consulting and all the staff, all the work that they do for clinics across the country. I'm not talking to staff now like I used to, but just knowing that they're working and helping out and being able to kind of be a part of the life of community health centers, and indirectly supporting a population that needs help. It's easy not to, I think it's easy to get into the details and not recognize that what we're doing is helping that population or those people with those needs. But indirectly we are. And it's something that I think we should all take, pride in. And then also I feel it's for me, it's rewarding that when you look across the country, I don't know, and maybe there is, but I don't know of another agency that is doing what we're doing and has the footprint that we have and the name recognition that we have and the reputation. I think we're unique in that. And again, I think it comes back to staff that just really take our core values to heart, and they're, delivering on those, and they're people recognize that. So I think that's another real rewarding aspect of being a part of Community Link Consulting.
Mm-hmm. I think too, I think back to one of the original reasons that you wanted to start a different kind of consulting firm, and that was so that people had a really great place to work.
Yeah. Yeah, I remember working at Moss Adams, and for 3 or 4 months out of the year, it was, you guys have to just really dedicate yourself to work. And that's all you do. And I felt when we started Community Link Consulting and when I left Moss Adams, I felt like, what is the point of doing that? Why can't people work 40 hours? And because that's what people expect. I mean, work is not an end, it's a means. And they don't go into work with the expectation that I'm just going to dedicate all my time to work. So one of our philosophies when we started Community Link Consulting was this is a 40-hour work week. And if we get to a point where, 40 hours is not enough, there may be a short period while we're filling the gap with somebody else, but we're going to fill the gap, and that's not an expectation. You're 40 hours to come in, you do your work, and we try and set objectives and, goals, and you achieve them, and that's why you're here. And you can go have a life doing other things besides just working all the time. And I think that, that's I guess one of the rewarding aspects too is that I think for the most part we've been able to achieve that.
Yeah, I think definitely there's some seasonality during the year as well as some travel, but generally the ebb and flow it's there with that.
Mm-hmm.
Mm-hmm.
Mm-hmm. And I think it's, that's a communication. I think we can get into our own world and, if work starts piling up, who am I delegating to? I don't know anybody. I don't know if I can or I should. They don't, or I don't know. You start taking on this responsibility and not communicating that responsibility. And I guess the takeaway is that that's something that if people at Community Link are feeling like I'm overworked and overwhelmed, it needs to be communicated, because I think the leadership's goal is to not put staff in that position. The other thing I guess I would say, and this is a little off topic, but I mentioned this very briefly a minute ago, and that's respect. And I feel like we as humans all deserve respect. And if we have clients that aren't respecting us, we shouldn't be working with them. And, leadership has a responsibility to protect and stick up for staff who are not in a place or who are in a place where they're feeling they're not being respected. And that's a bit of a gray area. I mean, one person might define respect differently than somebody else. So I'm not saying just take off as soon as there's a little bit of hardship in the work. But if people are being disrespectful and expecting things that are just not achievable and rude and unappreciative, we shouldn't be working for them.
Okay. I have one more question that's not on the list, but one thing that you are known for at Community Link is your great sense of humor. And that's one of the things we've talked about at CLC is there's always been that element of fun. And even though work is serious and we're doing a lot of important work at CLC, there's also that element of fun. And I just wondered if you had any comment on that or any funny stories to share.
I remember kind of a comment, funny story and a comment. I went to a church in Yakima before I went through a divorce, but we had this Valentine's Day dinner. And we went to this thing, and all the guys of this church were doing a skit for the women. And I dressed up with a pink tutu. And I did a little dance, and one of the guys said, "Joel, you have no self-respect." And it's like, I probably don't have much self-respect. But I think that's, at some level, that's kind of like, I can take myself seriously. But bottom line is, nobody really cares. I mean, they want to get their job done. So I guess my comment on that is if I have a sense of humor, and I don't know that I really do, but it's probably because I don't take myself that seriously. Unless it's respect. I want to be respected. But beyond that, I don't know. I don't know that I feel like I have a sense of humor, so that's better you call than my call.
Yeah. Well, I think it does bring it definitely gives people an uplift and brings a sense of joy to the workplace.
I think you're right. I think you're really right. I was reading an article about that, and it said that people who bring humor to the workplace have a much higher rate of success than people who don't. And I think that's around relationship development. It's around kind of camaraderie and alignment with the business. People feel like there's some humor and feel like they're able to contribute and participate in that. I mean, to me, it's just self-evident that people are going to have a better time coming to work. It's going to be more fun at work than if you just sit in a little box and do your little numbers, and that's all you ever do.
Mm-hmm. Yeah. Yeah, and I think it also gives just kind of a sense of hope that even though things feel really serious, there's usually a way to get through it or a creative solution.
All right.
All right, great. Well, thanks for
That's
answering all the questions. I'm really excited to have this 25-year podcast, and we'll be coming up with some new episodes soon.